watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. I'm Kenneth Iboma, and thank you so much for joining me on the show. Today, we'll take a closer look at the impact of the COVID-19 pandemic with the UNICEF representative in Nigeria, and he joins me to explore ways to build a more resilient healthcare system in Nigeria. You can join the conversations and let us know what you think. The hashtag to use is Beyond Markets. You can also hit me up at Kenneth Iboma and at CNBC Africa. Now, the United Nations Children Fund, UNICEF, says an additional 950 Nigerian children could die every day from preventable causes over the next 6 months as the COVID-19 pandemic disrupts routine services and threatens to weaken the health system. UNICEF Representative in Nigeria Peter Hawkins joins me now as we explore ways to build a more resilient healthcare system in Nigeria. Thank you so much for your time on the show, Peter. And I'd like to first start by looking at the impact we're seeing of the COVID-19 pandemic on Nigeria's health system, and how do we keep the progress we've made over the years?
Well, that's the most important thing. I mean, the impact of COVID is pretty profound, as it is in most countries, in that the health system will come under enormous pressure, but it's also the livelihoods for people in the country. And 87 million people in Nigeria are earning less than $1.90 a day, $1.90 a day. But the critical issue here is maintaining the health system so it can cope with COVID-19, but at the same time reinforce it so that the preventable diseases, as you call it, measles and other diseases, are addressed during the COVID-19. So at the end of COVID-19, children don't die with measles. What we're doing together with the government is ensuring that there are enough vaccine for measles, for BCG, Penta 3, etc., in the country, so there's no stock out. Secondly, around COVID-19, the priority has to be the protection of health workers wherever they are in the country, so they can continue to respond to the health needs of the population, whether it's COVID, whether it's routine immunization, whether it's antenatal or what have you. And then the third is to reinforce routine immunization at this very difficult time. A lot of the vaccination that's done in Nigeria is through campaigns. You cannot do campaigns during the crisis with COVID around. So it's to reinforce the primary healthcare systems, retrain them, reinvigorate their contact with the communities, and get the communities to understand what is happening about COVID, but also why they need to continue to take their children to the primary healthcare center for routine immunization, the mothers to the health center for antenatal, and the babies that are sick or malnourished to the centers for nutritional support.
Yeah, because this is a major disruption to the routine health services, and on one hand, we're seeing the pandemic, ravage, cause its damage across the continent, even around the world. But then, for people who are sick, who are wary about going to healthcare to the hospitals because of the fear of contracting COVID, what message do you have for that?
Well, that's exactly right, and this is your figure of 950 children per day could die as a result of the failure of the health system to be able to respond. And John Hopkins and UNICEF have highlighted this figure for Nigeria, as indeed for many other countries. I mean, globally, it's 6,000 children a day could die if the health systems are not reinforced during this pandemic. And so we're doing everything we can. The National Primary Healthcare Division of the Ministry of Health and their sister organizations at state level are being reinforced, and reinforce the training, reinforce the healthcare, the safety of the healthcare workers, and reinforcing the importance of routine immunization, especially when there's a pandemic. Now, what your point is so right. We have to get into the communities and into the behavior of those communities so that they feel they can trust and understand the importance of the healthcare system and routine immunization, antenatal nutrition, etc., at this very important time.
It also speaks to, the need to build resilience in the healthcare system. When you look at shocks like this, they are usually unplanned for. We understand that the healthcare system in Africa, in Nigeria, was still a long way from being perfect. But then a shock like this is coming in there. I'd like to get your thoughts on, how we can build that resilience against future shocks.
I think that's right, and a lot of progress has been made in Nigeria over the past few years, and is building on that progress. I think, Kenneth, one of the really important things here, though, is the resilience of the people themselves, and it's their resilience to whatever happens around them, whether it's COVID, whether it's measles or what have you, that they're able to respond positively to that. Through measures like social distancing, covering up the faces and noses with the masks, and staying at home as much as is possible. And that's the first question. The second is better understanding the need for immunization and the importance of immunization, especially against measles and some of the preventable diseases. 23 million children have survived as a result of measles in this 21st century. So the past 20 years, it's estimated 23 million children. That's a global figure. That's a lot of children. And trying to get the communities to understand the importance of immunization is crucial, so that they do trust the health system. They do have faith in that health system. And the health system themselves reaching out to those communities, reinforcing the one-stopness of primary health care, and really being able to respond to the needs of that population in a way that a mother could come, have her antenatal needs met, a newborn's immunization done, and if there's one of the children sick, their nutritional requirements come through as well.
Looking at figures from your website, and I'm seeing you expect about 6,800 more Nigerian maternal deaths to occur in just about 6 months due to this pandemic as well.
Yeah, and it is an important area. I mean, we focus on children, but the mothers and expected mothers especially, and it really is a critical time for them. They have to be resilient. They have to be able to access the services when they need it. But most importantly, they need to have faith that what is happening to them, they can cope with what is happening to them. But more than that, they can go out and reach out and get the safe health care that is required at this important time. And it's a difficult area, as you have alluded to. The health system hasn't always been robust. Communities haven't always had the trust in the health system. This is the time when that trust, that compact, needs to be reinforced and really pushed through, so that at the end of the pandemic, we have a stronger health system, but a more resilient population.
But looking at the nature of this pandemic, I can't help but think about the challenges people will have, especially in different parts of the rural parts of the country. Sanitation challenges here. Access to clean water is still an issue in here. And we understand we're talking about washing our hands, and keeping clean. But then I understand that there are people in parts of this country who don't have access to clean water.
Absolutely, and you've hit the nail on the head. This is a multi-sectoral response this pandemic requires. It's not just a health pandemic. It's an issue around water. 32% of Nigerians do not have access to enough water. So when we tell them to wash their hands, they don't have water to drink, let alone to wash with. And we've got to find different ways of trying to, one, allow them to access that. So through the primary healthcare system, we're trying to accelerate the number of centers that have water. Only 7% of health centers in Nigeria have accessible water in the center, let alone for populations around it. We need people to better understand their nutritional requirements so that they are able to be fitter and more resilient to the pandemic. Education is a key part of this response. Children are at home today. How can we keep their learning experience continuing? How do we put in place back to school programs so that the children who have stopped going to school want to go to school? The parents who have seen the benefit, the out-of-pocket benefit of not sending their children to school, actually saying our investment in education is still worth it, and continue that investment so that the children can go to school. Teenage pregnancies notoriously at this on occasions like this when there are people staying at home. How do we allow teenage girls who might have become pregnant or had the baby to return to school in a way that is seamless to their own needs?
All right, then I needed to hold that thought for a while. We'll just take a quick break, and when we return, definitely we'll continue our conversation on the impact of COVID-19 on Nigeria. I've been speaking to Peter Hawkins, he's the UNICEF representative in Nigeria. Beyond Market continues after the break. Welcome back to Beyond Markets. If you're just joining us, Peter Hawkins, the UNICEF representative in Nigeria, is our guest today, and we've been assessing how the COVID-19 pandemic is affecting development outcomes in Nigeria, especially around healthcare, and now we're moving on to education. Peter, just before the break, you were talking about education, and I'd like you to speak more on the impact we're seeing on this on this front, as well as the challenges we're going to see with inequalities, that could arise. Because we're in a position where children are not learning through digital platforms, they're learning through the internet, but then not so many people can afford that option.
Absolutely, Kenneth, and the education system is very weak in Nigeria at this point in time, and reinforcing it has got to be our big priority because it's the future of the country. Children today are not going to school across Nigeria. As indeed many other countries, but accessing community initiatives for education, accessing education through the radio, accessing, as you quite rightly said, through digital means. But there is a divide. But trying to do community, trying to do radio, trying to do digital helps deliver that divide on a more equitable basis. But many children will be left behind. Nigeria is also got 10.5 million children out of school. So you're already starting way back behind the curve on that. So it's not only trying to make sure that the children today have a positive learning experience or continued learning experience, but it's also when they go back to school that the in-between situation is overcome. Many children might become out of school children because they've enjoyed their time not going to school, playing on the streets, playing football or what have you, or whatever else. Girl children, the parents saying actually they're here at home, they're more useful at home than going to school. The out-of-pocket costs of going to school suddenly become more prohibitive as the livelihoods and as different options are available to parents. And we need to really push through that the out-of-school children, the children who've not been to school at this period, with back-to-school programs that really encourage them to go back to school. And the schools have got to be ready. Some classrooms have got 90, 100 people in it. The schools got to use this time to see how they can better accommodate those children in the post-COVID era so they can come back, catch up, and move forward.
I can't help but think about the internally displaced people in Nigeria and the children amongst them. I'm trying to imagine how they can adjust to this new normal.
And that's going to be a big challenge. It was a challenge before, and it's going to be an even bigger challenge going forward. But we at UNICEF, together with other partners, are really investing highly in trying to get now over 1 million displaced children back to school. So let's say the school year starts in September. Let's hope it does. It starts by September. We're trying to move into the direction where, from this time last year, 1 million more children go back to school in the Northeast, in that conflict area. It's difficult, building schools, getting teachers, getting parents to send their children to school, getting the children themselves to go to the school. All of those things compact at a time when livelihoods is difficult, social norms have been upset, and the children themselves might have lost confidence on their learning experience and not want to go back. But we have to galvanize the resilience of this country, the resilience of the children of this country needs to come to the fore, and they will come through. And UNICEF and other players are really trying to galvanize an effort so that when they go back to school, the back to school campaign is successful. And in the Northeast, where most of the conflict is, where most of the displaced are, that those people really do find a value in what has come out of this, right, and embrace the learning experience that a school environment will offer them.
Let's also see from one report you say the risks and challenges internally displaced children face and urgent actions needed to protect them. You know, I'm trying to imagine how the work, with the nature of the work that you do, how you can carry it out at a time like this in the middle of a pandemic.
It is very, very difficult. And you know, our compass of how we've been working for decades has gone. And we've got to find different ways of working, different initiatives that allow us to take this forward. So one of the things the United Nations is trying to do in the camps is decongest the camps, expand them, the area out so there's more spacing. It's very, very difficult to do that in these congested areas. Put more washing water and soap out so people wash their hands, making sure that communities have masks to be able to stay protected. Have better information around it. You know, and with the masks, so, you know, UNICEF have managed to get a group of women together, a women's organization together to sew some masks and to sell those masks and to generate some sort of income as well as social distribution of those masks. And that seems to be, it's a small scale at the moment, but starting to build some sort of momentum. But then I think, Kenneth, going back to our original discussion, it's also with those camps is making sure that immunization continues. It's making sure that there's sufficient water so they can drink and they can wash well. And all those sort of small things that might not have been as important before have become even more important now. And really pushing to respond to the needs of the displaced in this very difficult environment is a critical part of what UNICEF and our partners are trying to do.
I'm trying to get into the challenge around food security, because I understand this at this point in time it's probably going to be a nightmare, especially for some regions that are plagued with conflict, prolonged conflict, that, you know, locals can't even go to the farms anymore. I'd like to hear your thoughts on what you're doing around food security.
Well, I think, Kenneth, you've hit the nail on the head on that. It's about ensuring that the farmers feel confident that they can go to the land, plant, and ensure the bit of food security that does exist in Nigeria. That is so crucial. The value chain of agricultural production must continue, and everything must be done to ensure that happens. That's one part. The second part is the livelihoods of people. As you know, the recession is there. A lot of people are daily workers. They haven't been able to work. Their work has been interrupted, and we have to overcome with social protection programs. So we're working with the government, both at federal and at state level, to ensure that the social protection basket net programs, which have resilience built into them, is expanded. The figure is moving from 1.2 million, I think it's to 3.6 million in the end, people to get some sort of subsidy or some sort of cash grant to be able to continue. But then the third is, especially in the northeast and the northwest of Nigeria, is the whole nutritional problem there. It's ensuring that there's enough ready-to-eat emergency food at the primary healthcare centres across the north. So when children are malnourished, they can go there and get a service that meets their needs. That is crucial in a COVID-19 period, and it will be even more crucial after COVID-19 that it happens. But there's one other thing that I think we also must when we talk about food security and COVID-19 that we must be aware of. It's the gender-based violence, the violence against children, that at times like this, when communities are stretched, when communities are staying at home and not being able to move around, violence against children and women comes to the fore. And when there's food insecurity, when there is a threat of conflict or displacement or what have you, it's exacerbated to a degree that it becomes a major issue. And we're trying to address some of those issues through food security, through social protection, but through other measures like enforcing the protection measures and responses that the government have to be able to respond to those acute needs of gender-based violence and violence against children.
But looking at the multidimensional work you're doing there, I'm trying to imagine the strain on your resources. How's the journey been, getting funding for your work in Nigeria?
And it is difficult because we're trying a two-prong approach, as you would, I'm sure, fully understand. One is to maintain our existing programs. We call it COVID-proofing them to make sure that they're still relevant, that they are adjusted to meet the needs of the post-COVID period, and reinforcing some of the things like education, like social protection, like child protection and gender-based violence, so that we can respond better to those, while at the same time responding directly to the COVID-19 pandemic, where the absorption capacity is very, very limited. But so those two coming together stretches not only our resources, but also our capacity to be able to respond when our own staff are affected by COVID. Our own staff have met the ultimate sacrifice that COVID has brought tragically on many, many people. We're adjusting, we're moving, we're able to step by step make those improvements. But you're right, at the end of the day, the resources are limited, and we can only do the best we can with those limited resources and be as effective, efficient, and directive and focused as we can. But we're doing it, and that's to the credit of all UNICEF staff, the United Nations staff that are based all around this enormous and vast and beautiful country, trying to serve and deliver every day.
But looking at development outcomes, though, it's just a decade away to the target set for the Sustainable Development Goals. And I would like to hear from your thoughts and from your experience, what you've seen, areas that you think work needs to be fast-tracked for us to achieve, to at least get to some of the goals.
Yeah, and we're a decade away. We were celebrating that at the beginning of this year, and lo and behold, then COVID comes and takes it over. We must lose sight of that fact. The SDGs in 2030 are a critical part of what we all must do and must try and achieve. SDG 3 and SDG 4 and the SDGs on health and education have to be the most important in light of what is happening today, but is also in light in trying to build the resilience of this country and its people, the services and that compact between government and people and the trust that has, and investing in the future of the country, reinforcing the health system, reinforcing the educational system. And the educational system has been failing, and it's creaking at every stage, and we really do need to push that up. But Kenneth, I mean, it is so important that the United Nations and the government of Nigeria, whether at federal level or at state level, continue to aspire to 2030 and the SDGs. If we lose sight of that, we will lose everything that has been built over the past 20, 30 years in Nigeria on the social and economic side, and must take that forward.
Finally, before I let you go, Peter, we just recently celebrated Children's Day, and I'm trying to understand what the key message has been for UNICEF this year in the midst of a pandemic.
That's a very. I celebrated it with all the children of our staff throughout the country on Zoom. Their introduction to Zoom, their introduction to the new way of working, and it was fantastic. The questions they asked me is probably where our priorities would be. I mean, one of them asked me whether UNICEF can stop COVID, and of course we can't. But what can they do to be able to prevent and stay safe? And that was one of the main messages that I put across and will continue to put across. Stay safe. Don't go out. Wear a mask. If you have to go out, social distancing, washing your hands, and being sensible. I mean, that's the key. The second is, as this country goes through COVID and the economic recession that will inevitably hit every country in the world as global recession takes place, is what are you going to invest in the most? What's the priority investment? And it has to be on health and education. So whatever else you need to cut, don't cut those two. In actual fact, reinforce those. So as each country, and Nigeria in particular, reassesses its budget, relooks at the money that it has, what are you going to do next? Investment in health, investment in education gives you the returns.
All right, then. Peter says prioritize health and education. Thank you so much for your time. Peter Hawkins is the UNICEF representative in Nigeria. Thank you so much for your time. Definitely quite a lot to think through there in that conversation. And that's it on Beyond Markets. And thank you so much for being a part of the show. Remember, you can watch Beyond Markets at 5 p.m. West Africa time daily and have access to all episodes of Beyond Markets on our website at CNBCAfrica.com. For me and the team, have a wonderful day.